Sometimes if you have sex too much, your semen quality goes down.
Okay.
So during that fertile period is perhaps not have sex so much.
Okay, all right.
I'm really feeling down, I'm feeling really suicidal. It scares me at the moment.
You aren't the normal Sammy that you were a few weeks ago.
I don't think I need any medication.
Right, okay.
I definitely don't think I'm getting ill.
You've got to remember that you're a very good age. Sometimes you've got to slow down a bit.
Yeah, I know, and I don't want to slow down so much.
Any thoughts regarding work? You're 33 and not worked for 10 years. And,
Yeah,
you know,
it's shocking.
the chances of returning to work are...
Dwindling as we speak,
Yeah.
I know.
Morning.
How can I help?
OK, that's all booked. Bye. It's going to be a good day, Nana.
So anyway, how are you getting on?
Well, I'd like to ask you a question, whether you can answer it or not, I don't know. And that's the nicotine, I think, from smoking, has lodged in my arteries.
It's not the nicotine that's doing that to you. It's all the rest of the rubbish that's in a cigarette and chemicals.
Yeah, it's a fine dust, basically, isn't it, smoke?
Yeah, well, it's killing you. And that's what's going through your arteries. How many cigarettes have you smoked since you saw me Thursday?
4, 8, about 12.
OK, so I thought you were going to use the patches and the gum and not smoke. That was the idea of this.
Well, I did, but I cannot resist.
So you're still craving for cigarettes. So then the regime that I put you on is not high enough. You've got a 4 milligram gum. Have you been using the gum?
Well, I don't like to criticise it, but it's inclined, I think, to give me like indigestion.
Yeah, it does. It can do. It can do.
You know about that, okay.
How about a lozenge? I tried to try a lozenge instead. So what you do is you suck it and you park it, you suck it and park it, and you keep doing that.
What flavour are they?
Mint.
Oh, yeah.
Is that all right?
Yeah, that's fine. Very limited on that, I expect.
Oh, there's not a lot of choice, I'm afraid.
No.
Okay.
I'm not being picky.
Okay.
I'd like to try them if I can.
Okay, and I'm going to up the patches, so 5 extra milligrams in it, and we'll see if that regime helps then.
Okay.
So, are you going to come back and see me next week?
I have to check my diary.
Okay, well, I'll make a new appointment because you need to see me. This is something you need to come back and see me for.
Okay.
All right?
Yeah.
Hey, little man. Hello. Hi. Hi.
I'm so sorry. Yelp if you need me to.
It's all right.
But we're just concerned that he doesn't seem to be
It's tough coming into the big world, isn't it?
calming down, gaining weight. He has gained weight.
So what are the things that you've noticed, Barbara, that make you worried about Sammy?
So there was lots of things which changed. So, for example, you are more energetic than usual. So it seems like the reactions are much stronger than usual. Also, you sleep with service charges, which never happened before.
Sorry, what was that?
Stopped paying service charges, which is very unusual for
Okay,
you.
so you have to pay service charges.
Yeah.
But you're not doing it.
And
No, I'm
Sammy
just
stopped
behind in
3
arrears.
months. Yeah,
Right.
But
in
in a
arrears.
week's time, I'm about £100 towards that.
How did that happen, that you got in arrears?
I just slipped behind in payments.
Right, but then you must have spent the money on something else.
Yeah.
So what did you buy?
I just bought shaving, grooming kit.
Must have been a lot of money on that.
Yeah.
Why did you spend so much money on those things?
I don't know how to...
Did you really need them, all of those things?
Yeah, because I groom every day.
Yeah, but you obviously you used to be able to afford to buy what you needed.
Yeah.
And pay the charges.
Yeah.
But were there other things that you bought?
Some shirt, t-shirts, underpants, and cologne.
All right, okay. Bipolar disorder is usually really quite a severe mental health problem in which your mood can either be very high, which is we call either manic or hypomanic, or really very low, depressed. People become hyper. They often buy loads of stuff. Often people will buy things that they can't really afford. They may think that they're famous. I had a patient who bought a ticket on Concorde because he thought he needed to go to the States straight away for no particular reason. I mean, obviously, you've been living at the hostel there for a long time now.
Yeah, 5 years, 4 months now. Today is 5 years, 4 months.
Is this the first time you've been in arrears?
Yeah, first time, yeah.
So something's not right, is it? Because you wouldn't normally allow that to happen, because you're very responsible.
Yeah.
The worry that I think Barbara has, that you're beginning to show early signs that you might actually be relapsing.
No. Because the thing is, I saw my consultant psychiatrist on Saturday.
Did you?
Dr. Potter. Yeah, I saw him on the street near where I live.
All right.
And he said I look very well.
Right. You can't tell what's going on inside your head from just looking at you, because I would have said you look very well as well.
Yeah.
And the thing is that what we know with the kind of problem that you have, that when people relapse, the first thing that you notice is not that they don't look well, they look fine. And it's just what they're doing isn't quite normal.
You're still enjoying it if you've been here for 20 years.
Yeah. You know, it's a nice place to work and everybody's
That's exactly
pleasant.
what I say about my place of work.
You know.
Why is everyone getting flowers? I want flowers. Oh my God, is he being serious? I want flowers. Aaron, send me flowers, please.
Gonna feel and then I'll clean it with this alcohol wipe.
You're very practical about the shop. Most men are not practical.
How far do you have to be out of the borough to still be here?
So we have...
I don't want to leave here ever.
That's lovely.
Thank you so much.
No problem.
Thank you very much,
then.
Dr. Sheila.
Okay.
Thank you.
Bye-bye.
Yes, thank you.
I think that these are warning signs. If we don't do anything, you will get ill. And we really don't want that to happen again, because you've rebuilt your life. You've been absolutely
well, today
fine.
is 5 years, 4 months
Yeah.
since I was discharged from the hospital.
Yeah. So you've done...
And within myself, I know if I was going to feel ill when I was...
Okay, is that really the case?
Yeah, I know.
That you know? Because most people with your illness don't.
Yeah.
It's very unusual for people with your kind of illness to know. It's always other people who say you're not well, and that you have to then accept that they're right, and that means you should be on treatment.
How do you feel about that, Sammy?
Well, at the moment, I don't think I need any medication.
Yeah.
I think I've done well. 5 years and 4 months since March 29th, 2010, I was discharged from the hospital.
Yeah.
I motivate myself, I go for walks, my weight is coming down. I don't think I need any medication.
Right, okay.
I definitely don't think I'm getting ill.
Right.
I feel well within myself.
Okay, well, our advice is you aren't the normal Sammy that you were a few weeks ago, that you've changed. You aren't as well as you were. You can't notice that, you can't see that, and that's often the case. In Sammy's case, I thought it was really important that he should be on medication now, because it sounded as though he was beginning to relapse, and that could have been disastrous for him, as he might have ended up in hospital, because he wasn't taking any medication for bipolar disorder and hadn't been taking any for quite a long time. We would generally say to somebody like you really ought to be on medication forever. When you get ill, you get seriously ill and you end up going back into hospital. It's such a huge setback if that happens. We think we can avoid it now. All you need to do is to restart treatment. He is a patient, actually, he does get the final say as to whether he takes medication or not. He's taking a chance if he doesn't take it, but then maybe he's entitled to take that chance. Are you willing to see the psychiatrist?
I'm willing to see the psychiatrist.
So we'll do that. We'll do one step at a time.
Yeah.
I do think it's worthwhile going down this route. So what I will do then today is I'll phone them up. I'll try and arrange that you get an urgent appointment to be seen as quickly as possible. I'm sorry, you're obviously upset about that.
Well, I'll see the psychiatrist, talk to him.
Yeah.
He can assess.
Yeah.
He'll assess me, and then he'll tell me if he thinks I'm getting ill or not.
Yeah. Okay.
I think it will be the best thing to do.
Okay.
Right now.
No, you're right. That's that's the right way to do it because they're the experts.
Yeah.
Thank you
All
very
right.
much.
Thank you.
Okay. Bye-bye.
Bye.
Bye-bye.
Yeah, take a seat. All right.
Morning. So, is there anything about your health that you particularly wanted to discuss today? Asthma is another of your medical problems. Is that well controlled, or
What, asthma?
Yeah.
Well, no, I have had a bit of breathing problems recently. Not bad, but I'm not breathing as deeply as I would like to.
And you're using
I've
your
had some-
medication?
Yes, I've been using that.
Do you know what triggers your asthma? What makes it worse?
Well, I think that it's the pollution,
Okay.
the heat, the pollution, the traffic,
Yeah.
the high road.
Have you had any falls, or do you worry about falling?
I can walk without the stick, but I'm not confident on the high road because of the kids.
Well,
on
the road is very uneven.
It's very
and there's lots of
uneven.
people about, isn't there?
And there are too many people, and they
Yeah.
don't notice you, and they bash into you, and I mean, I really think it's safer to have a stick. I think actually what I'm objecting to now is the scooters. There's so many of them.
Yeah, and the little kids as well.
And
They
grown-ups
go
on
ahead of
scooters.
their parents, so they can't even.
Exactly. They
Yeah.
don't know what they're doing. Parents are usually on mobile phones anyway.
But you feel well in yourself? Do you feel well?
Well, I feel a bit miserable sometimes, but mainly, I mean, it's just not getting around as much as I did.
The mobility.
It's just a bit depressing not to.
But I think
Not
also
to be
you've
as
got
active
to
as
you've
I
got
would
to
like.
remember that you're a very good age, and so you've got to you know, sometimes you've got to slow down a bit.
Yeah, I know. Well, I don't want to slow down so much. I mean, I do feel I've got to get out. That's why I decided yesterday I've got to go out. So I took myself, as I say, I went to Collierwood. And then I felt quite pleased with myself that I got there on my own, you see, on the tube without depending on somebody else being there. And then I went to Mark's and had something to eat and came back home and felt fine.
Have you ever heard of the befriending service from Age UK?
I've heard of it, but I don't think I need it. I've got friends.
You've got enough friends
I've
around.
got a friend who came in this morning, actually. I mean, I think changing the focus does help, and I think probably if I go on holiday, I will probably be able to do it.
Well, have a wonderful holiday.
Yes, it's only a week.
Well, a week is better than none at all,
A week's
isn't it?
better than nothing, yes. Okay.
All right, thank you for coming. All right, bye-bye.
When are you looking at doing your work experience? Okay, so I think this coming week might be too soon. But if you wanted to write in, then I'm sure she would consider that.
That's the only time I come in. Very good. Come in, take a seat. Busy day, indeed. Always. William has been in to see me on a number of occasions to discuss his anxiety and his cannabis misuse.
I find that the weed is the only thing that keeps me sane.
When I saw him last, we discussed ways forwards for this to reduce down the cannabis misuse and to try and increase his self-esteem with a long-term view to returning to the workplace.
I really felt bad coming today, not asking not doing what you asked me to do, and I just thought, well, God, if I can't do what the doctors asked me to do, and the job centre are literally might as well be talking to a brick wall.
How are you today?
Yeah, I'm okay. I've been better, but I've been worse. So
okay.
I feel like a better person, like less stressed, like more energy. I'm not thinking about the weed as much. It would be nice if I could cut down and knock it on the head completely to the point where, you know, I don't think about it, but I don't ever envisage it. I don't, not anytime soon.
Okay. And have you what's happening at the moment? Any thoughts regarding work?
I mean, I'm still at that. I say crossroads. It's not really a crossroads. I feel like I'm just at that precipice with like no real skills that I can translate into the workplace. I mean, I've had some good jobs like many years ago, like another life ago, really. And the gap on my CV is just so like huge.
Yeah.
That like I don't get the callbacks or anything.
So it's 10 years without work.
It's like 10 years without work. I mean, obviously I've done like a day here, a couple of days here, helped out and done a bit of voluntary work as well. But I feel like I'm going backwards.
How are we going to get things going forwards?
Obviously, I don't want to be on the sick. I don't want to be a benefit, like seen as benefit scum.
At the moment, we've got you're 33 and not worked for 10 years. And
I know, it's shocking.
The chances of returning to work are
dwindling as we speak. I know.
We want you to become productive again, and you know.
I had big dreams. I had big dreams. Like this is what my first couple of counsellors was saying. Like, yeah, you built yourself up too high.
So
mate.
the only counselling that we would have access to is through WCDAS or IDAS or whatever we're calling them.
It's literally that's my only option from counselling.
From a counselling point of view.
Through the drug angle. See, I'd rather talk to a wall than talk to someone like condescending with their.
And you've said before.
I mean, what you said before? To me, what's the alternative? Go and have a drink? Like, no thanks.
Yeah,
I'd rather die.
You've said before with the from the cannabis point of view, you use it to kind of treat anxieties and so forth. What if we tried another medication? A medication from an anxiety point of view. Have you been on anything antidepressant, anti-anxiety?
I was on antidepressants for about 3 months, and it was the worst 3 months of my life. Like, you know
which medication that was?
I think it was fluoxetine.
Fluoxetine.
It's like.
What happens if we tried something, perhaps a similar sort of medication called sertraline, and we gave it a try? Should we do that?
Yeah.
Okay.
So I'm open to suggestions because it's literally I've been on this path for like 10, 12 years, bouncing along like just blowing in the wind, literally. And
well, let's have a go because it might help to control the anxiety, and then that may well mean that you're smoking less cannabis. When we start people on these medications, we do like to review them early, so in 2 weeks' time.
Okay.
And so I'll do the sick note for 2 weeks.
Okay.
And then bring you back. That goes through to the 13th. Brilliant. Okay.
Thank you very much.
I'll see you in a couple of weeks' time.
Thank you.
Okay, take care. And you.
No problem. All right, bye. Good morning, Vicky speaking. How can I help?
Yep, they'll be ready to collect after 4 tomorrow.
All right. Oh, bear with me. Hello? Would you like your daughter to come through?
Yes.
Yes, please.
She's my next of kin and she does everything for me.
Hello, how are you? Come in, take a seat.
I'm an idiot because I've just been swimming and I've gone completely deaf.
Oh no.
Well, not completely, but I've got one question while I'm here. I was sorting through my pill drawer, found this packet which is only February, and I've no idea what they're for. I hope it's not something I should be taking.
I'll tell you. That's one I don't actually know.
I can't say it, that's for sure.
So nausea and vertigo?
Oh, I know what it is. I had a very strange giddy turn.
Yeah, there you go.
And my neighbours all thought I was having a stroke.
Oh,
I was talking strangely. And
did it just suddenly come on?
Yeah, and I was trying to use my mobile to ring somebody and I couldn't sort of coordinate properly. Oh, I can't look at that.
And it was nausea and...
I'm just trying to think of the name of it. Gone from me as well.
Was it about your ears? Was it to do with your ears, the balance?
I think so, yes.
Labyrinthitis?
Yes, that's it.
Mm.
It was very frightening because when I couldn't use the phone and I was feeling unsteady and I'd thrown up all over my flat, but I got to the front door and the dustmen were just there and they were wonderful.
Oh.
They went down the road and got my friend for me.
Did it feel like you were on a boat?
Yeah.
That's the imbalance of the ears.
Yeah. And I wasn't speaking clear. Oh, God,
Mm.
that's all the signs for a stroke.
And of course, once you start to worry,
Yes.
that makes everything worse, doesn't it? But it's natural to worry. There you go.
Lovely.
All done.
Thank you very much.
Pleasure.
Now I'm killing time. I heard yesterday that I've got an appointment at George's this afternoon.
Oh,
So I've
okay.
got an appointment at the skin clinic. So.
Oh, you getting around this
Yes,
week?
absolutely.
Nice to see you, always.
All the bits are being checked.
Take care. Bye-bye.
Yo, yo, yo.
Hi, Patrick. Come and have a seat. How are you?
Not great.
So it's been a while since I saw you.
I'm really feeling down. I'm feeling
Yeah.
really suicidal. It scares me at the moment.
So I had a letter from A&E from a couple of weeks ago. What happened?
I ended up going to St George's, which I got an initial assessment, and I waited for about 4 hours and basically discharged with 2 leaflets. Nothing.
When anyone ever comes in and tells us about them feeling low or feeling down, it's really important to explore with them exactly how extensive those dark thoughts are. Are they just something that they've had a fleeting thought that would be a lot easier if you weren't alive? Or actually, is it more planned than that? Have they really thought through what they may do, and what steps have they taken to try that?
So had you done anything to actually hurt yourself, or was it just the kind of number of thoughts of it?
What happened is I started drinking and I knew that was dangerous, so I stopped drinking when I phoned, and it was the thoughts that where it would lead.
And how much are you drinking at the moment?
I'm sort of drinking every other day, and when I'm drinking it's probably about 6 cans of cider or 2 bottles of wine, that sort of drinking.
So that's kind of crept up quite a bit, hasn't it?
Yeah, from not drinking at all and slowly coming back to it, I mean, that's what scares me. If I'm depressed and I'm anxiety, if I put alcohol on top of it, it's dangerous. It's really dangerous.
You're seeing Dr. Sayer this morning. He'll see you up to 15 minutes late, so hopefully you'll be here, but I'll put him a little note.
How are you? Good morning, you all right? That's it.
I must stop coming in here because I was in yesterday.
Well, just bring your bed.
Any pain with it, or is it just more?
Yeah, it is. It is a bit painful. It's a bit of a joke in our house that it's a repetitive strain injury from fishing.
It might be a joke, but that's probably what's happened.
Right.
How often during the last year have you been unable to remember what happened the night before because you had been drinking?
Starting drinking again is a warning sign that, and it distorts everything, and then it brings in the depression and the anxiety, and then I don't know which is which. I don't know if it's alcohol related or am I using alcohol to solve it, but it's dangerous.
It goes hand in hand often, doesn't it?
Yeah.
So the drug and alcohol service, what help are they giving you at the moment, or what contact have you got with them?
I'm going to see them for an assessment. It's a drop-in, and they like you to turn up at least 3 times a week.
And how motivated do you feel about that at the moment?
I really have to do that.
Good.
Because, see, I'm isolated. I'm in my bedsit. I'm feeling sorry for myself. I'm getting depressed, and it's dangerous.
Okay.
Sometimes I just feel like, oh, what's the point?
Mhm.
It's just a game. But as you say, there's not a lot you can do right now. It's a slow process.
But it sounds like it's moving in the right direction in terms of the things that you're doing.
Yeah, and the medication I'm not even too sure, but I mean, medication doesn't work with alcohol, so...
No. So how much, you're having 150 at the moment, is that
Yeah.
right? Yeah. And you're still having it every day, or?
I'm still having it, but alcohol just neutralises it or something. I don't know what it does, but...
Yeah, so alcohol's a depressant, isn't it? So it kind of switch. I mean, there's no point in having an antidepressant.
Yeah, when you've got a depressant.
If you're going to take a depressant as well. Yeah. So we know that you've got a lot of insight into things, don't you? You kind of know how things go. You've done this merry-go-round.
Yeah, the counselling, it seems to be going okay. It's something I've been looking for over a year.
Yeah.
And I finally got it, and if I finally got it, for Christ's sake, tell her what's going on.
Yeah.
Because I tend to tell people what I wish was going on. I convince people I'm actually okay.
Yeah.
This other woman from Once With Mine, she's really helpful. She contacts me about once a week.
Okay, so that's extra support there.
Yeah, and it makes a difference. And
Good.
she's the one encouraging me, do this, and it's like somebody giving you a checklist, and it's so helpful, because you just do it.
Good.
Yeah.
Do as you're told.
Yeah.
All right, it's nice to see you, Patrick.
Okay, so that's everything. Okay.
Later.
And then-
Okay.
Cheers.
Bye.
Yeah, a half an hour appointment, and you say that you can never get hold of me. I'll give you half an hour of my liquid gold time, and you're not even here. Oh, what? So 4 o'clock next Wednesday.
What's brought you in today?
Basically, I have been having like pain in one of my breasts.
Right.
And I wasn't sure what it could be, basically. I'm probably like a little bit oversensitive anyway, because my mum had breast cancer about 3 years ago. So it's something I kind of keep an eye out for.
What's happening with the pain?
It's not really, it's kind of just like a bit of an ache, and it feels like more like bruising.
Okay, and how long has it been there for?
About 3 weeks.
Okay.
It was kind of straight after my period and has carried on.
Okay, and are you on oral contraceptive or not? No.
No.
Okay. I wouldn't think much more of it at the moment
Okay.
in someone that is your age, in 24.
I was just really worried, I think, just because of
What
kind
happened?
of everything.
Yeah, understandable.
But I just
What
thought
age was she?
She's actually had cancer twice. So she
On the
had,
breast twice? Or
no, she had a lymphoma when she was about 26.
Oh.
And then breast cancer recently, and she's about 47, I think.
Okay.
So, because it's kind of a pattern with her, like I recently have been, the last couple of years have been kind of a bit more.
And is there anyone else in the family that's had breast cancer?
Yes, one of my great aunts on my mum's side. So she got diagnosed shortly after my mum did. So,
okay,
yeah.
but she's a great aunt.
So she's my mum's aunt.
The mum's aunt.
Yeah.
Okay, yes, yeah, okay. So I always think it's quite useful form. This is from Oxford University with their for their cancer genetics referrals. So if your mum had been diagnosed below the age of 40, one close relative, then we would be at that point we would be saying, well, actually maybe we'll do some genetic testing. And there's a couple of genes like the BRCA gene which are closely related to that. And often then you see if there's someone's got a BRCA gene, there tends to be several people that have had problems. So it might be somebody that presents very young, but there could also be 2 close relatives with breast cancer under the age of 60. So we're not sort of approaching any of these criteria. So we're not really thinking about increased risk. So I think that's hopefully quite a reassuring thing to think
that is
about.
very reassuring, yeah.
I think in general practice over the last few years, we've certainly seen a difference in the numbers of people presenting with very vague symptoms who are very concerned about significant underlying causes for this. There's so much coverage in the media of missed cancers and so much concern that any symptom could well be cancer. If you ended up with this sort of breast pain that was ongoing and it was coming from the breast tissue, then we would refer to a breast clinic at that point.
Okay, so just keep an eye on it, basically.
I really would, yeah.
Okay, cool.
The real challenge in general practice is trying to identify the patients where those symptoms are important and we should be investigating them further. So yeah, I wouldn't worry too much about that, and then I'll just see how things go.
Yeah, okay, brilliant.
Okay.
Great, thank you very much.
No worries, take care. Have a good afternoon.
Thanks, you too.
Bye then.
$10:30, is that with Dr. Shah? All right then, take care.
All right
Bye.
then. Hi. Are you showing the way to go?
Okay.
Yeah.
Thank you very much.
Who's this? Is this your...
No, this is my friend's
Your
grandson.
friend's grandson. All right.
Angela suffers from high blood pressure and comes to see me regularly to monitor this and to get her blood pressure medication. On the last occasion, we also discussed her addiction problems, and we agreed she was going to go to the drug and alcohol support team to try and help with this.
I get the shakes, you know, and I'm literally holding the can like that to drink it. I'm so sick of me. I'm so sick of me.
Should we do your blood pressure? You've been taking your tablets?
Okay, yeah.
Yeah?
Yeah, slowly. Come closer.
Blood pressure is great. Sorry to
Is
interrupt. I've never seen it so good. 119 over 78.
Oh, brilliant. Happy days.
So what happened then?
I broke it. I broke these bits. I can't remember. Sector cranium or something. What are you doing? Oh.
So what actually happened then? You were in a fight. Who was the fight with?
Doesn't matter.
Okay.
But the thing is, he punched me right here. It's gone down. But it was so there. It was there. It's the lump is still there. I said, if you're going to X-ray me, X-ray my head. But they didn't. But I went after 3 days after the fact. It just got out of hand. He went like that. And that was it.
How much?
So he punched you first?
He did, yeah. Right, yeah. It's still there. It's still like it's going down, but it's still.
Yeah.
It was all over. It was all over. I even called the police.
You called the police?
Yeah.
And did they?
Because I took the knife and I went for him and I just thought, Angela, just leave. I ran with the knife and everything.
Okay. So where do we go from here? Did you ever go back to IDAS?
Of course, yeah. Oh, yeah. I'm still liaising with them. I've got an appointment. Of course. I need them. I can't do this on my own. I need you all.
Do you have a social worker through them? I ask you this all the time, but...
No, I still haven't. And I've not for want of trying. No. They didn't even bother with me. I don't know why.
And this, you're seeing someone,
Yeah.
is she like your caseworker? Or
She is.
Is she good?
It's very hard for me as a 44-year-old to deal with somebody who's in their 20s to tell me what. You know, it's embarrassing. I feel embarrassed. But,
What kind of things do you talk to her? Is it
I
focusing?
don't talk to her about anything, to be quite honest.
Okay.
With you. She's too young. I can't work with her, to be quite honest with you. I've got children her age, man,
Yeah.
or a child, my daughter. It's not cool. I don't feel comfortable. I really don't.
I mean, you can say that. You can say it doesn't need to be a personal thing, but due to sort of age difference, it's not someone I feel...
Isn't that not age discrimination?
No. It's completely within...
Ageism, is that what they call it?
Yeah, but I think it's fine. So it has to be somebody that you feel you can speak to and can help you.
I'd rather somebody else I could speak to.
I'm going to try and just speak to them at IAT as well about this. If you can give this, I've just put it together with the appointment. This is a letter. If you can give that on Thursday.
Yeah.
If you want to ask for someone different, that's up to you. I haven't said
No,
anything. I don't
no.
want to compromise. I'll give you 3 months of your blood pressure tablets.
Yeah,
Make it awkward
I
when you see
appreciate
her.
that.
Okay. There's the prescriptions, months of each of these. Okay.
Come, let's go. We'll get some outside. Thank you.
Fine. Well done. I will
Thank
see
you.
That's
Thank you
fine.
very much.
Blood pressure's very good, and
Yeah,
we'll
yeah.
see. I'll try and speak to IAPT and see what they say.
Thank you.
Okay.
टाइगर जैसा आकर के खाना
कैसे
ऐसे
सब इकट्ठे करेंगे
इतना बड़ा
Hi, I'm Sean with the doctors. How are you doing? I'm good. Come in. What can I do? I'm good, thank you. Yes.
Excellent.
What can I do for you?
Well, my wife and I are trying to have a baby.
Yeah.
And she's come in, she's a member of the same place as well. And
Yeah.
we've been trying for a little while now.
Yeah.
I know that we're in our mid-30s, so we wanted just to kind of like see, I don't know, maybe have a test to see how we're going, and you know,
Sure.
I think she's already kind of had the first stage of testing done,
Okay.
and so that was just what we were kind of hoping for. So yeah.
Fine. How long have you been trying for now?
I would say probably we tried a little while ago, and then it's probably been about 6 to 9 months now we've been trying for.
Okay.
So, yeah. Just getting that little bit of concern in place now because we've been trying to follow a schedule, see how it works, and nothing's really taken flight yet. So.
Okay, fine. And then she's come off the pill again, or?
Oh no, she never went back on.
She never went back on it.
No.
I see. So you just stopped using condoms, or?
Yeah. That's it. Yeah.
Okay. And how often are you having sex?
I'd say probably, I don't know, maybe like over the period, kind of like the window that we're given. You know, we have one of those apps on your phone, so we have a 4 or 5 day period or whatever.
Yeah.
So we probably have like sex at least once a day over those times.
Okay.
And then in between, probably, I don't know, maybe 2 or 3 times.
A week?
Yeah. I know, probably in between the time. Because of work and everything, it's hard to find the time. We
So
try, but
so 2 to 3 times
the other 2
outside of the
weeks,
fertile window.
Yeah, that's it. Yeah.
And what's your lifestyle like in terms of? You don't look overweight.
No, thanks. Oh, I try and work out. I exercise. I play football once a week and go to the gym as well.
What about smoking?
No, I used to smoke, but I gave up about 6 months ago.
And alcohol?
I'm not a big drinker. Maybe like 4 drinks per week. I would say something along those kind of lines.
Yeah, not excessive at all. So there's probably not much you can do lifestyle-wise because you're already leading a pretty healthy lifestyle, really, aren't you?
Thanks. Yeah, no, I tried to, definitely.
Yeah, okay. I mean, let's get a semen analysis done for you, okay? And then we can see what that shows. You know, the majority of people will get pregnant. You know, so sometimes it's just a matter of time. You know, if we can't find a problem, let's just keep having sex and it should happen.
Of course.
You know, probability-wise, even in your age group, you know, sometimes it would take longer than a year. But I think, you know, we would potentially refer you in another 6 months if you weren't getting anywhere unless we found a problem.
I've been coughing for weeks and weeks and weeks, and I've been given an antibiotic. It's not working.
Are you breathless?
I feel a bit breathless, yeah. And in the mornings, it's really, really nice. I've got really thick green phlegm, and sometimes it has blood in it.
It's just not going away. We've got to the stage where I have to get it checked out. Exactly.
Make some noise. We do. Oh, the roar was good. The roar was good, but actually the singing was better, and we got to see right to the back of the throat.
I mean, they're all for the chest. The one you had is actually for the chest. I think the fact that you've had an antibiotic and you're still coughing, we need to do a chest X-ray to see what's going on with your lungs.
It looks absolutely perfect at the back. So she's looking good.
Hi, Sheila. Hi, come on in. Come and have a seat.
Thank you.
Right, Dr. Beecraft, how can I help?
First of all, I had this this cough going on for a week now, and yeah, I know it's probably you've heard loads of people going on about their coughs, etc. But like I say, it's keeping me up all night. Can you give me some antibiotics for that?
Fine, let's have a see. So, are you a smoker?
Yes.
How much do you smoke?
About, I don't know, 6 cigarettes a day.
Okay.
Yeah.
And is that something you've done for a long time?
Yeah.
Yeah, okay. And what are your thoughts about your smoking?
I don't have any thoughts about my smoking.
Do you think it's a good thing or a bad thing? Or?
It's not making me cough. It's something else making me cough.
Let's have a little look. Just pop that on your finger. And what is it you do for work?
I'm not working at the moment.
Okay. Right, well done. Slip that off. And can I get you to stand up and we can have a little listen to your chest? So nice, big, deep breaths in and out for me. Okay. Right. You have got some extra noise in your chest, so yes, I think you do need some antibiotics. I was just looking at your notes before you came in and saw that actually we never see you very often, but when we do, it was kind of about a similar thing back in December. My worry is you're getting these chest infections relatively regularly, and that's probably related to the smoking. When you're younger, you smoke and it doesn't really affect you, but over time, it will start to build up, and this is often what the pattern we see is people then start to get ill more quickly.
Okay.
So I think we need to be a bit careful about your smoking.
Okay, I'll quit then.
Have you ever tried to quit before?
Yeah, I think I've quit for a couple of years before, and well, I have, you know, it's part of my sort of my morning thing. I have a roll up in the garden. Yeah, I'll work on that. I mean,
because we've got some of our nurses here do kind of a stop smoking kind of session. With
yeah,
you
I
and
think
things.
it's about you deciding to do it. Really,
yeah,
is the
so it's
the
kind of
main
motivation.
thing.
I think is coming from you. But okay, I'm sorry, 3 times a day for a week.
Yes.
And then leave it a few weeks and then come back and see me.
Right.
And make it a double appointment.
Yes.
Okay.
Okay.
All right. Take care then.
Cheers.
Bye.
Hello. How are you?
I need to pee. I need to pee, Aaron. I'm gonna go.
I'm so tired. Oh, I'm totally broken.
Really?
I had one of those big pints of Red Bull, so I'm going to go and have another one of those.
Pro Plus?
Okay. Red Bull.
Onwards.
You get in there, see it, mate. See it.
See ya.
The only thing is, sometimes if you have sex too much, your semen quality goes down.
Okay.
So potentially I would say during that fertile period is perhaps not have sex so much.
Okay, all right.
So probably 2 or 3 times a week
Okay.
consistently is probably better
Yeah.
than every day during that
Okay.
fertile period. Yeah. Let me get a semen pack for you. So this is the pot. So no ejaculation for 2 to 7 days, okay? Wash your hands, obviously, no lubricants. You masturbate into here, okay? And you need to collect all of the ejaculate, okay? Name, date and time on the bottle.
Okay.
And then you need to get it to the pathology lab within an hour of doing the sample.
Okay,
This is the
all
tricky
right.
bit.
Yeah, okay.
The other problem is that the hospital is not the local hospital.
Oh, okay, all right.
Logistically, you've got to think if that's possible.
Quickly.
Okay?
I've got a car, so.
If it's not possible, okay,
Yeah.
then they can arrange for you to have a room in the hospital.
Okay, yeah,
to masturbate in, okay? But you need to book
Everybody's
that, pre-book that room,
Okay. All right, no
I don't
worries.
think a horrible hospital room is be very pleasant, but you'll just have to think how long it's going to take you to get there, what time you go.
Okay.
And keep it warm, okay, in your
Yeah.
pocket. Okay?
Okay, all right, no worries. All right.
Tray. Okay?
No worries.
And then we'll find out. Hopefully it'll be fine.
Okay, all right.
Good luck, okay?
Well, thank you very much. Appreciate it. And
I will get the result and then you can give me a call for the results, okay? Once you've done it.
Cool. Wonderful. Thank you very much for
all
your help.
right.
Appreciate it.
Bye-bye.
Bye.
Well, I might still be here, but I finish at 7, so you might just catch me on the way out.
Okay.
Thank you
No,
very
so
much.
it's all right for you. You can jump up like a whippet.
Thank you, doctor.
Okay.
Good. All right. Take care. Bye.
Go on.
She does.
Very good.
Good girl. Thank you.
All right, take it easy.